Are you currently suffering from knee stiffness and or pain? If so, this is a video for you. I'm going to give you 2 wonderful exercises that will help you reduce a lot of the knee pain that you're having, but more importantly, help you improve your knee range of motion in a very gentle and guided way that will help you improve your knee mobility, thus in turn helping out with your pain that you might be having, thus becoming your limitations. So why does this commonly happen, right? So when individuals have an injury, it's not uncommon for us to stop doing the thing that we were doing because it was causing pain, because we were usually told by a provider or someone else by that. So for instance, if you're having knee pain when squatting, well, most people will just say, well, just stop squatting. When we don't understand and realize being able to load your joints through a squatting pattern is actually very healthy and helpful for maintaining the integrity and health of the joints. But yet when we stop doing it, that joint actually starts to deteriorate and degenerate because it's not moving. So being able to move your joints through their full range of motion and under load is extremely helpful. So for many of us, we don't squat past 90 degrees, nor do we hardly ever extend our knee fully outside of maybe walking slightly. But even with walking, you don't typically see a very large terminal range of extension. So we're going to work on both terminal flexion, meaning end range, and terminal or end range extension. And we're going to do this supported in 2 different manners. Now the first one is you need a suspension trainer or rings or something that you can hold on to. It could be a doorknob, a banister, or something like that. But what we're going to do is we're going to lean back, holding onto these straps, and we're going to start to squat down. Now, so notice in my direction here, I'm going to go from a side view here. As I'm squatting down, I'm then coming in towards my butt. So I'm still leaning back. So the majority of my weight is in my heels, which reduces pressure on the knees. Now this allows me to go through further flexion without as much load, helping me out. Now load is actually very helpful, right? I can actually use load to help me go through more flexion as long as it's an appropriate amount of load and it's not too much. So I was dealing with this back when I had a meniscus surgery 6 months ago, as I lost a lot of terminal extension and a terminal flexion, and I had a lot of pain associated with it because of the swelling that was due to the surgery. Now, this was also the case when I actually injured the meniscus a couple months prior. And my rehab approach to regain my flexion and strength in that was simply this exercise. And as I would do this, I would start to get in deeper and deeper, and I'd also start to loosen my grip slightly so that I can go further with more weight. Now, to expand upon that, I would add a lift to my heels. So if I was to take a mat or something like that and put this, now I'm at a forward lean, right? So as I squat down, my knees are actually going to go forward more. So here I'm able to now do that same exercise where I'm coming in, but because my heels are elevated, it's going to increase the amount of flexion that I experience because my tibia is angled forward more, right? So I'm just going to keep doing that. I can increase the angle, I can increase how far forward I go, so on and so forth. Now, if you're having a lot of pain, you might simply be just starting with supported squats where you're trying to get below 90. The point here is start with where you are with a little bit of support and then try to get a little deeper. But this needs to be done on high repetitions. We're talking about 100 reps a day supported, which isn't going to be a lot because you're using support to build that range of motion, to break down that range of motion that you don't have, and increase that fluid to help that joint. Now the next one, you're gonna need some sort of an anchor and a band. So the bands that we're using, we're using a medium one first. The band, sorry about that, just knocked over the camera almost. We're using some sort of a monster or assisted band. So this is the size that I would use, but for demonstration purposes, we have a lighter one right now. So this is anchored to the wall. What I'm going to do is I'm going to put my foot inside the band with the band right at my knee joint line. Now, for many of us, we're lacking terminal knee extension for one reason or another. For many of us, we had pain with terminal extension, and so we basically just don't go into extension, and then again, you lose extension and you're not able to build upon that. So what I'm going here, right, is I'm basically using the band as a tool to push off against. So from a side view, all I'm trying to do is just push into extension, and the band would be pulling me in that direction. So this is similar to a quad set that you might have received in PT at some point, but with the bigger band, you're able to use your quads and your muscles to drive that heel down and straighten that knee even more. The counter force of the band, having you push against it, is helpful to achieve more extension. So similar to our supported squats, we're going to be doing high rep situations here. We're just pumping and building into that. I'm never forcing the knee into extension. I'm working with where I'm at, but yet I'm trying to approach a further degree of range of motion as I go through to enhance the range of motion. You cannot simply stay with where you feel comfortable, because that's where you've been living as it is. You have to use a tool or something to help you push that barrier further to expand upon your range of motion, which will obviously improve the amount of stiffness that you're feeling. That in turn helping with your pain, because you're able to do more. So if you're dealing with knee pain, if you're dealing with knee stiffness, and it's been that way for a while, it's not a lost cause. There's a lot that you can do about it, but more times than not, we want something to go from here to there fast, when in reality, you have to break down that range of motion rep after rep and day after day. I promise you that after 2 weeks of doing just these two exercises, your knees will be feeling tremendous. They'll be more open, they'll feel more fluid, they'll feel more bouncy, and you'll be able to do so much more to allow you to live a loud, adventurous life. Thanks for tuning in, guys. If you're digging this video, please give us a like, a share, a comment. We appreciate you helping us get this message out to help other individuals such as you live loud. What's up?